Welcome to another video of Ask Dr. Nancy. I'm Dr. Nancy Kroll. I'm a doctor of Oriental Medicine, and I coach women on how to lose weight, optimize their digestion, regain their vitality, and get to the root of chronic conditions such as autoimmunity. So today I'm really excited. I'm going to be talking about a subject that is very close to home. It's something that I've experienced quite a lot over my lifetime, and that's anxiety. I get asked all the time by women what to do about their anxiety, and I think it's actually far more prevalent than we really know. I would say 75% of my current clients have anxiety or had anxiety when they started working with me. And I actually had some anxiety come up yesterday, which made me decide to shoot this little video for you guys. So the thing to know about anxiety is that there's not a one-size-fits-all, which is basically health in general, but there's layers to anxiety, and we're going to go into those. So from my viewpoint and the viewpoint of Chinese medicine, there's always a two-prong approach. There's the root and the branch. The root is like the internal cause, the branch is the symptoms. And so when we're dealing with anxiety, we always want to address both. In general, people tend to focus on the branch, which is the symptom, which is the anxiety. But if you don't actually deal with the root, then you will continue to have anxiety. So there can be, let's talk about just the branch, so the symptoms of anxiety itself. We'll go from a functional medicine standpoint first. There can be different causes for anxiety. So if the microbiome, the gut health, is off, there's been a lot of clinical research that gut health affects psycho-emotional disorders such as anxiety and depression. So if you have little gut bugs that are not in the numbers that they should be, because it's all about the ratio, this can cause inflammation, which then inflammation in the brain can lead to things such as anxiety and depression. So there's that. Another cause for anxiety from a functional medicine standpoint can be hormones. So if your estrogen, if your sex hormones are off, or if your thyroid is off, or if your adrenals are off in some way, this can lead to anxiety. So on a physiological level. So when you have anxiety, it's really important that you get to the root cause. This is something that we always address in my Inside Out program. You do this through functional lab work, okay? But that's just one piece of the puzzle, right? So there is the physiological aspect, so getting to the root of maybe the gut health or the hormonal imbalance, but that's just one part. So that is the branch, that's the symptoms. It's also very important to deal with the root, okay? And the root is the reason why I love Chinese medicine, and that is your state of being, okay? So anxiety isn't an actual thing, right? It's an energy in the body, and there can be the physiological causes, but there's often a root stagnated emotion or false belief system that is at the root of that. So for instance, you can have had a experience in early life that then creates the lens that you look through your life through, okay? And that lens may or may not be serving you. So anxiety typically is connected in Chinese medicine to the kidneys or the spleen. So the spleen is overthinking, and the kidneys would be fear, right? So we have to get to the root of what is the belief that is perpetuating the overthinking and the fear, the desire for control of the future, essentially. And uncovering that is really at the root of anxiety, because if you don't start to shift those states of being, oftentimes those states of being, those false belief patterns, those repressed emotions of fear or rumination actually can be at the core as well of a lot of the physiological imbalances such as adrenal dysfunction, thyroid, sex hormones, all of it. I mean, it's all interconnected. There is no separation between mind and body. So when we're dealing with anxiety, you really want to start to, if you're suffering from anxiety, you want to start asking yourself, what is underneath this? And making sure that you have a practice, whether that's prayer, some form of devotional practice, meditation, yoga, mindfulness yoga, like a slower yin yoga, where you're allowing yourself to tap into your body and actually listen. Because oftentimes as well, it's just our body's way of communicating something. And our tendency as human beings is to want to push it away and ignore it, but we actually need to start listening to it. So what is underneath that? So say you're dealing with the physiological stuff, like you're dealing with the hormones and the gut health. You need to start uncovering why is this message coming up for me? What is the fear underneath this? What am I wanting to control? And then digging deeper and deeper and deeper and finding the truth, that rock bottom truth. And the rock bottom truths are often not that pleasant. They're like, I feel unlovable, or I feel unworthy, or, you know, they're kind of the deeper, darker parts of ourselves that we like to kind of hide away. But when we start to uncover these things and see why we want to control, why we're uncomfortable, where that tension and anxiety is coming from, that actually allows us to release it on a very deep subconscious level. So I hope that was really helpful for you guys. You can like this video, share it with anyone that you know that might be suffering from anxiety, and reach out to me if you ever need help. Also know that this is not medical advice. You do need to contact your primary care before making any drastic changes to any medications or anything that you're doing, but know that I firmly believe that we can always heal our body. You just need the right support. I look forward to our next video. Bye-bye.